Hello, hello, and welcome to another podcast episode of Overpowering Emotions, where I talk all things big emotions, emotion regulation. I am creating this episode. I'm traveling actually. I'm in New Zealand at the moment. I've been doing my spring speaking tour. And one of the things that I find I get a lot of pushback with is about breathing. And so that's what I want to focus on. And I thought I wanted, insert this little podcast just as a follow-up from some of the things that have come up because we learn about breathing. It's often the first tool that we learn about. We pull out of our coping toolbox when those emotions run high. It's simple, it feels good, it's portable, right? It's something we've all been told to do. Just breathe, take a deep breath, right? And we do know, yes, it can be grounding. Yes, it can be calming. It can be helpful. We know it can tap into our emotional brain and our nervous system and calm it down. But it's got to be used with the right intention. And so that's why I really caution using breathing because A, our bodies know how to breathe, and we're often teaching kids how to breathe improperly. So I'm not going to be going over the proper technique of how to breathe. I have talked about that in previous episodes, but I do want to talk about, a little bit more rationale around the breathing piece, okay? And how breathing can actually get in the way of emotion regulation. It can contribute to worse anxiety when we're not thinking through using it in effective ways. Okay, so if we're working with anxiety, with OCD, with emotional dysregulation, right, we really need to look at when does breathing help? When does it hurt? How do you know the difference, right? For ourselves, for our kids, the kids we support, our clients that we work with, whatever it is. Okay. So I want to make sure we're looking into some of the myths, especially around using breathing during skill building, when we're trying to work on exposures or frustration tolerance or managing those types of things. Okay. So that's really important. I think it's important. Okay. So let's look at the innocent question. Why do we even teach breathing in the first place? It does make sense, right? Breathing activates that parasympathetic and sympathetic nervous system. It slows down the heart rate. It gives us just that little bit of space between the stimulus, whatever the stressor is. It could be something in our environment, it could be a thought, and our response. So when we're looking at it that way, it can be a powerful regulation tool to get our prefrontal cortex, keep it online. If we've got a big test, for some kids, that breathing can actually be helpful. It's not necessarily about the technique unless you're teaching it incorrectly, like into the belly, for example. That's not where our lungs are. So we got to, know how we should be teaching breathing. But it's really about the intention. Why are we teaching it? Why are we using it in this moment? That's what matters. And so that's what I want to explain a little bit. Okay. So, first of all, if we're using breathing as avoidance or suppression, right? Sometimes people do that. They're using it as a way to distract themselves away from whatever is going on, okay? Especially in the heat of the moment. It's the same way, it's one of these sort of subtle ways that we can avoid or ease up the distress a little bit. It sounds really harmless, but our kids will do this, right? Just to take the edge off of going to a party and some edge off of my social anxiety, I'm going to have a drink. I'm going to take a toke of my joint, right? But it can really work against the goals of what we're working on. Suppression is a response-focused regulation strategy. And we know any suppression strategies to force an outcome, we're looking for a specific response, it actually has maladaptive effects. So if we're trying to suppress or shut down or create some response through breathing, that actually increases our emotional intensity. Okay. You've probably seen this in real life, right? A child's really working hard not to be anxious. They're using that deep breathing as a shield, and the anxiety just builds. It's the same thing if we're trying to sleep. We're trying to sleep, we're stressing about sleep, or we're doing everything we can to sleep. We're just stressing ourselves out more, right? And so we get into this vicious cycle of anxiety. The harder we're trying to push a feeling away by trying to breathe, I just want to get rid of this feeling. I was told that that's going to get rid of all of the anxiety. It's going to calm down that nervous system. It's going to make me feel, it's just going to push back. And it becomes a safety behavior in this case, right? It might feel good in the moment, but it's preventing our kids from learning that that emotion itself isn't dangerous, that I can have this feeling and still do the things that I need to do. Okay, so this is the first big takeaway. Breathing isn't helpful when we're trying to run away from a feeling, because we need kids to feel all the feelings, accept it. I talk about, just like if we're in quicksand, we want to sit back in that quicksand, right? We want to embrace it all. So that's how we get out of it, is just bring it on. So if we're using breathing like, I'm feeling anxious, I want to calm my heart, this is uncomfortable, that's a problem. Okay. Another problem is that breathing can mask anxiety, especially, again, when we're working on skills in exposure therapy, when we're working on emotion regulation, when we're working on frustration tolerance. It gives us the illusion that that anxiety is manageable because of the breathing. I can only manage this feeling if I do my breathing or my relaxation or whatever the strategy is. It becomes a safety behavior. When what is it that we want kids to learn? That I can tolerate anxiety even without trying to control it. Because sometimes it's so overwhelming, we cannot control it. And if kids think that I should just be able to breathe it away, they're going to start feeling hopeless and helpless when they're still feeling anxious. And there's going to be some situations that demand a lot more than just breathing, right? It does help keep our prefrontal cortex online, but we're still feeling those anxious feelings. So it's just like taking a benzo, right? If a kid comes to me, they know, oh, Carolyn's going to make me do hard things. I'm going to take my Ativan. I'm going to take a benzo. I'm going to take smoke a toke of my joints. I'm going to have a drink. If they're doing that before an exposure, before the hard work, using breathing in the same way is the same thing. It's teaching them, I can't handle it on my own. I need to do this thing to make sure I can handle it. Just like Raj, right? To take that social anxiety, talking to girls, I got to take the edge off. So what we really want to teach, that's what we want to think about. What is it that we want to teach? What we really want to teach is I can do hard things. Even when this wave of distress comes, I can ride that wave of distress and I can come out okay on the other side. That's really important. So it just starts interfering with emotional learning when we're focusing on emotional learning. So when breathing's used reflexively to calm down during an exposure or during the work that we need to do, it's interfering with what we call inhibitory learning. So the process of learning that the feared outcomes don't happen, or if they do, they're tolerable. Right? So in other words, it's preventing the brain from updating its threat learning. So it's saying to the brain, this is only safe because you are doing something to make it safe. We're getting out of mindfulness. We're getting sucked into emotion, meaning we can't see anything else. This is dangerous. Alert, alert. We need to breathe. It's not safe otherwise. We need to be able to sit with it and see for ourselves. We don't have to do anything and we're probably safe, right? So if they're believing it's only safe because I'm doing something to make it safe in this way it might be the breathing, it's not the message we want to reinforce. Okay, so if we're working with kids, if we're working on frustration tolerance, emotion regulation, anxiety, exposure, whatever it is, here's what we got to remember. We don't need to eliminate the distress. Kids need to learn I can handle it. I can ride that wave of distress without doing anything, and I can survive it. Okay? So we don't want breathing to unintentionally interfere with emotional learning, especially when it's used to suppress, avoid, make anxiety stop, make it feel less terrible. Okay. So that's really important to think about. And that's why I talk about this. So yes, breathing's great in lots of different ways, but not when we're teaching, not when we're working through this stuff. Because if we dive a little deeper and go into the paradoxical reactions, the paradoxical patterns that can start emerging, right? It becomes a huge problem instead of a solution. So for one, we're already inhibiting their learning. So they are never learning. I can handle it on my own without trying to control the outcomes. It's not about the outcomes. We don't have any control. We have no idea if it's going to work. We don't have control. But you might have experienced some of this paradox yourself, right? Some people, they try to meditate, they try to clear their minds. I mean, this is a big one. You try to clear your minds. What happens? Your mind just starts bouncing around even more. It gets even more monkey brain, right? Same thing. If people are trying to breathe, they're trying to relax, they might start feeling more anxious. I know certainly for myself. This is known, and I know I've talked about it before, but this is known as relaxation-induced anxiety, or RIA. Okay. And it can happen with any calming practice, with breathing, with guided meditation, anything that we're doing to try to relax. When we try to control the outcome, right? It's that Chinese, finger trap. The more we try to be happy and push for that outcome, the worse off we are. We know that and over and over and over in the research, right? The happier we try to be, the more relaxed we try to be, the more we try to fall asleep, we're just making it worse. So when we're looking at someone, with anxiety and they're turning their attention inwards during, let's say, a breathing exercise, they start to notice maybe, a twitch and then a little twitch and a more of a twitch. And now my heartbeat, now my breath. Okay. And if there's kiddos who have high interoceptive sensitivity, a lot of my girls, the teenage girls seem to have it, or anybody who has panic attacks or health anxiety, like that's usually where we see it. Now they've got this heightened awareness, right? And so now it's just another trigger for anxiety. So suddenly they're thinking, wait, is my heart beating too fast? Why is my head, why I'm feeling lightheaded? I'm feeling dizzy. Am I doing this wrong? So instead of calming down, they ramp up. Or like for myself, it's like, it's not working. Right? Like come on, I'm wasting time doing this thing. I need to calm down. Yeah, that's my ADHD brain. But over time, this can really lead to a belief that relaxation is dangerous. Or, right, I'm hopeless and helpless. Nothing works. I'm just going to be like this forever. And then that hopeless helplessness sets in. And then what's the point of life? So, I mean, this is really disheartening for any of our, kids that we're working with. We want them to feel better and they want to feel better. But now they might start avoiding good things, yoga and breathing and other calming practices, because they're afraid of what their bodies might do in that quiet. Or it's just reinforcing the story that I can't handle it. Something's wrong with me, inherently wrong with me. Okay. So the takeaway here, right? If a kiddo is saying that they feel worse during breathing exercises, believe them and get curious. It might be RIA or a variation of RIA. So we don't want to keep pushing harder into the relaxation. Maybe we need to look at it from a different angle, right? Maybe we're doing interoceptive exposure, but you have to be with it. It's not about breathing or increasing some of those things. Maybe it's mindful observation, distress tolerance. I mean, these are things that I focus on. I'm not focusing on breathing. I'm managing that, the distress tolerance and things like that. Okay. Now, there's a lesser known, but I thought this might be a good time to talk about it because it is very distressing as well. But we don't talk a lot about this, but it's a sensory motor OCD, like obsessive compulsiveness. Okay. So this is someone who is hyper aware of their bodily functioning. So blinking, swallowing, bowel movements, breathing. So the obsession here is, what if I never stop noticing? I'm always focusing on my breath. And there's a little skip in my breath. What does that mean? Right? Or a skip in my heart. What does that mean? Once that thought takes hold, I mean, this isn't uber common. I don't see this a lot, but it is, a possibility. But now, if they have that thought, if we're focusing so much on breathing and breathing and breathing and breathing, what the outcome is, breathing itself just can become this focus of rumination and, focus of distress. So they might start trying all sorts of strategies to forget about their breathing, which of course, the more we try to forget, right? Don't think of a white bear. Whatever you do, don't think of a white bear. Our brain just goes there and we just loop and loop and loop and loop. So that can be really tricky too. So this is one of the clear example of where breathing in itself can become a problem. It's not soothing, it's intrusive. And so the work here really isn't relaxation. It's about sensitization, acceptance, habituation. They need to learn that, awareness, you got to be there, be mindful, but we're not trying to fight it or make it go away. And that's why I do say mindfulness is important. I'm not trying to relax. I'm not trying to force an outcome. I hope you're hearing this message. With breathing, we're trying to force an outcome. We're telling kids you should be in control of how you're feeling, right? That's what we need to get rid of. So that's not what it is. Okay. Now, when we're looking at breathing as a compulsion, so in OCD, we've got the obsessive thoughts, the ruminating thoughts, and then the compulsion, right? So I need to act in a certain way. I'm worried about someone breaking in, so I'm going to check all the locks. Okay. So when we're looking more broadly, it's not just a sensory motor thing, it can become a compulsion in OCD, this breathing. Okay. So OCD uses this logic. If I just breathe the right way, this bad thing won't happen. Or I can control some outcome. If I breathe calmly, that proves I'm a good person. There's nothing wrong with me, right? If I feel a sense of relief, that means I'm okay. But now we're trying to force an outcome, which we don't have any control over. But that turns breathing into a ritual, right? Just like checking or washing or praying or whatever it is that we do. It becomes a strategy to reduce that distress or to gain certainty, to force some outcome, which is exactly what OCD, the C, is trying to do, right? But when we're looking at treatment, we don't want to do that. We don't want to give the obsession, the satisfaction of being in control, right? We can never predict certainty and predictability. So we got to do the opposite. And yet breathing just feeds into that. Okay. So when a kid asks, can I just take a few deep breaths? We got to ask about the function. What are you hoping the breathing will do? Same thing. If you are going to give breathing as a coping skill, what is it that you're hoping that breathing will do? Okay. If the answer is, I just want to get through this moment, right? Maybe it's okay. Maybe. But I would rather just see if they can get through the moment riding that wave without having to do anything would be ideal. But for sure, if the answer is, I just want to make the anxiety go away, right? I don't want to feel this. I don't like this. I just want to get rid of we got to pause here. That's not a problem. Like that's not a good thing. That's a problem. That's a safety behavior. We're reinforcing the idea that anxiety is intolerable. It's dangerous. This feeling is intolerable. It's dangerous and I can't handle it. We don't want to reinforce that. Okay. So let's just recap because I know it's a lot. Breathing interferes with that emotional learning, especially when we're using it to suppress, avoid, control some outcome, right? Sometimes we have these paradoxical reactions, right? That relaxation-induced anxiety or the sensory motor OCD, where breathing can become a trigger for anxiety. And in OCD, that breathing might be used compulsively to, again, try to control, that outcome, and it's undermining their recovery. Okay, so we just got to remember breathing isn't bad. It's how we're using it. Why are we giving it to kids? Why are they using it? Okay, so that's really important to think about. Okay, so we don't want to throw it all away, right? We know that it can backfire if we're using it in the wrong way, but we do know breathing can still be very effective, right? When it's done with the right intention in the right context. So maybe let's quickly look at when is breathing helpful, right? And how can we support emotion regulation without reinforcing that avoidance or compulsions or anything else? So mindful breathing is good outside of skills, outside of exposure, outside of when we're working on distress tolerance or anything like that. Mindfulness is always helpful. I find mindfulness, we got to stay with it, right? Because we cannot tell somebody else's emotional brain that they're safe. We cannot convince them. We're just going to escalate them. The only thing that can teach somebody's emotional brain that they're safe and, they don't have to freak out is their own prefrontal cortex. Okay. So we got to stop trying to control things ourselves too. But that's where mindfulness comes in. If I can just be here without doing anything, I'm going to say, hey, I can handle it. Hey, amygdala, you don't need to freak out so much. Over time, that amygdala won't be so sensitive and it won't be, triggering all the time. So mindfulness practices, that could include breath awareness. Okay. I don't personally use breath awareness. Sure. Breathe, relax, when you're just want to focus, when your focus is just on that, when you're already calm, you want to lower your overall arousal level, that's absolutely fine. Okay. So you can include that, if they want to ground themselves and just practice, but it's not about getting rid of feelings. It's just by noticing our breathing. I do meditations all the time, and oftentimes it involves breathing. I end up doing my own body scans and different things, but that's okay. So in mindful breathing, the goal is not to feel calm. It's just to observe the breath as it is. It's just practicing mindfulness. Am I breathing fast? Am I breathing shallowly? Am I breathing evenly, unevenly? Whatever. We're not trying to change the breathing. We're just bringing our attention back when the mind wanders and paying attention to what is now. And that practice, that mindfulness really supports emotional regulation because it's building attentional flexibility, it's increasing body awareness, it's increasing our practice of accepting whatever is without trying to control the outcome. Okay. So maybe just now, like notice right now, pay attention to your breath. Where do you feel it? Is it in your nose? Are you breathing through your nose, through your mouth? Where do you notice the breath? For me, it's in my chest. I notice it in my chest. Maybe you feel, I try when I'm focusing on breathing, I'm focusing, filling my lungs and my back, not my stomach, right? But just let your attention rest there. Don't try to change anything, right? Don't judge it, just notice. Am I breathing shallowly? Am I breathing deeply? And if your mind wanders, that's okay. Just bring it back. There's nothing to fix. There's nothing to change. Just notice it. So this kind of mindful breathing, again, it's not about escaping anxiety. We're practicing how to just be with what is. So we're learning to coexist with it. I talk a lot about the Hulk brain as the dysregulated brain. And Dr. Banner, right, wants to keep his prefrontal cortex online. He can't get rid of the Hulk, but when the Hulk comes, Dr. Banner learned to coexist with Hulk, to keep that prefrontal cortex online, to coexist. That's what we need to do. Okay. So again, we shouldn't use breathing as the go-to tool during exposures, during emotional peaks, right? Or anything like that. Okay. But breathing can be a way to pause before reacting, right? Okay, this is a tough question. Let me think about it, right? Or pause. Okay, you just said something really mean. Let me think. It could be a pause, maybe. It could be a practice during transition times, right? Maybe you do your breathing like for yourself. Maybe it's your commute from work to home, right? Maybe kids can use it as a transition from their commute from school to home, right? So we're using it proactively. It's part of our daily rituals. It's just promoting general wellness, right? Your morning routines, your yoga, walking meditations, anything like that. That kind of breathing does support long-term nervous system regulation. It helps promote energy balance, self-awareness, right? As long as it's not being used to avoid discomfort, okay? So we do need to think about the moment it becomes something like, if I don't breathe right, something bad's going to happen, or I need to do this to feel okay, it's probably not helpful anymore, right? So we just always need to understand the function of why we're doing it. It's not just the form of the tool, it's why are we using this tool? What's the goal? Now, sometimes, especially in the early stages of, working through emotion regulation, maybe they've just started counseling or you're just working on these skills at home, right? Or it could be during those overwhelming moments, kids might need to pause and recenter. So if we're using it just to pause and recenter, it can be a brief anchor. And it's just that, right? To use it as a pause to steady ourselves, see where we're at so we can, problem solve what's coming next. So that can be especially helpful, if there is a crisis moment, right? If we have kiddos with neurodevelopmental differences who need predictable, structured, entry points into regulation, right? Just to trigger, okay, we're going to go do this work. Maybe with co-regulation, right? We're modeling some of these things, but I just find it's a really slippery slope. So you just got to make sure you have a very clear boundary, that it's not about getting rid of the feeling. It's about staying with it just long enough so you can choose your next step. So breathing is just to give you space to pause. Okay, so I think that that's important. Now, one of the most important things that we can do is help kids ask themselves what they're hoping to do with the breathing. But I take a step back because kids probably aren't choosing to do breathing. So really, what is it that you're hoping to do with the breathing? What are you hoping it will do? Just keep coming back to that. Why am I telling a child to breathe right now? Okay. So is it helping you be present right here with what's here? Or are you trying to push the feeling away? Is it supporting something or is it trying to eliminate something? Okay, so we want to always check in with our intention, with their intention. And we're building these metacognitive awareness skills, right? And that's at the heart of effective emotion regulation. We got to stop telling kids what to do. We got to ask open-ended questions. We're going to validate, this is tough. So what are you going to do, right? That's important. So yes, breathing can be helpful when it's used with awareness, with intentionality. It is effective outside of exposure, as part of your normal mindfulness, wellness, value-based routine, whatever that is. It becomes unhelpful when we're trying to escape, control, neutralize emotional experiences. And it's not about the breath itself, right? It's the purpose it serves. So I think that that's really important, right? So we just got to think about, how we're talking about, breathing with kids, how we're using it and modeling it for ourselves, right? We got to talk about it in a way that's empowering and not making them feel like they're hopeless and helpless and they need and that they have any control over those emotional outcomes. Because I always say, I always show dials, right? There's this emotional dial that we have no control over. So if you're trying to turn that emotional dial down, that's a problem. Okay, so how do we help them build that emotion tolerance without needing to fix or flee, from all of their feelings? That's really what we're focusing on. Okay, developing sort of an intentional relationship with breathing, if breathing is even important for you to work on. Okay, so we're talking about it and reframing it in ways that it's not used to make distress go away. That is so important because that's where I get kids coming to me and young adults and adults, older adults coming to me and saying, don't tell me to breathe. It's not helpful. It makes things worse. It's because they've always, been told this, right? So it's not to make the distress go away. I think you've heard me say this over and over again. I know I sound repetitive, but this is what I really want to talk about, okay? It can be a way to anchor ourselves, okay? So we're always validating their feeling and normalizing the discomfort. We're not erasing it. We cannot get rid of it. They need to understand emotions are not dangerous. We need to have all emotions. It wouldn't make sense that they're ingrained in our brain and in our body if we didn't need to have them for some reason. Anxiety, sadness, frustration, grief, humiliation, shame, embarrassment, they're all part of being human. Your brain is doing exactly what it's supposed to do. You don't have to feel calm to be okay. You don't have to eliminate that uncomfortable feeling to move forward and do the things that you need to do, to go to school, to write your test, to go to the sleepover. Sometimes the most powerful thing that we can say is, validate that you're experiencing, you can feel this. Of course you feel this way, right? If they're nervous, oh, it's a new school year and I'm really nervous about my teacher, my friends, right? As parents, we want to reassure it's okay. There's nothing to worry about. Your teacher's super nice, right? We're trying to control that emotion. We're trying to turn that emotion down, have control. We got to stop doing that. Of course you feel that way. And I know you can feel this. Now, what are we going to do next, right? And so confidence, validate and confidence that they're going to figure it out. Okay. So it's not about controlling that emotion. It's about giving ourselves maybe that moment to choose how we're going to respond. So I've talked a little bit about values. Maybe we can connect breathing to goals and values, not symptom control though, right? So we're not going to say, take a deep breath. You're feeling anxious, take a deep breath to calm down. Maybe we're going to take a breath just to stay connected to what matters right now. I often show, if you haven't seen me speak, there's a great video. If you YouTube stuck on an escalator, you'll see these two people going up an escalator. The escalator stops, it breaks down, and then they're like, oh, what are we going to do? Right? And they're calling for help. There's two people stuck on an escalator. We get stuck with our emotion. We can't see anything else. It's like emergency. We're stuck. We got to pull it out. If we can pull that emotion out, we can see the bigger picture. I can just walk off. So I like showing kids that video so we can say sometimes we get stuck on the escalator. Now we've got common language, right? So sometimes it's we're stuck. That breath can help us stay connected so we can pull away for a second and see what is it that we need to do next. We don't have to react impulsively on autopilot. How do we handle it next? So it's just a subtle shift, right? It's teaching them that they can feel capable even with these uncomfortable feelings. They're not broken, right? We're giving them that self-leadership rather than symptom avoidance. So we just want to make sure we're focusing. Now, if they are hyper aware of their breathing or they're worrying about doing it wrong, we just want to take that pressure off. We're going to invite curiosity. What do you notice about your breath right now? Or where are you noticing it in your nose, in your chest, in your belly? What happens if you just watch it like waves coming and going up and down? We just want to replace control with curiosity. If we get curious with it, we're keeping our prefrontal cortex online. It's helping teach that those sensations, whatever they're feeling, it can be observed without being fixed. And again, if there's sensory motor OCD, right, where the fear is about never being able to unnotice the breath or if they're doing it right or anything, it's not about fighting it. It's just that awareness to build the tolerance for it. Okay. So we want to make sure breathing is part of everyday life. We need to all breathe to live, but it's not the main tool during the work that we need to do. Okay, so practicing mindful breathing as part of your daily routines before, you go to school, before you start a test, winding down before bed, that's okay. But telling them every time they feel nervous before they present in a class or every time they feel nervous when they're going to do this thing, that's not helpful. We want breathing to be available, but not required. It's a support, but not a crutch. So we want to make sure we're framing it. When big feelings show up, we can pause. What are some things you can do to pause, right? The most effective strategies are the ones that kids come up with themselves. If they say, okay, I'm going to take a deep breath, and really it's the exhalation. It's the exhalation, not the inhalation. It's the exhalation. If they choose that, so I'm going to take a breath and make a choice, then cool, right? If that's what they want to use, it's the pause approach. That kind of helps build the emotion regulation, that executive functioning, their own agency. Okay, so yes, breathing can support emotion regulation, but not when we're using it to feel better and to avoid. Okay, it becomes problematic when we're trying to suppress, control, calm down, right? At all costs, it becomes a compulsion. The intention behind it is more important than breathing itself, right? I think I've talked about this a lot. You should be able to summarize everything now. We can use breathing flexibly with awareness. It's just in service of not stopping the discomfort, but just being, part of a healthy lifestyle, really, right? That's where it can become therapeutic. Okay. So we need to make sure, if we are going to use breathing, the mindfulness component, we want them to stay present, not protected. We want to keep them curious, not controlling, right? That's really important. So thank you for listening. Lots to think about, but I just wanted to clarify where I came from because I know a lot of therapists, especially if there's trauma-informed therapists. I'm trauma-informed. I understand. I've done so much training in polyvagal and I understand all of this. But truly, like even with, if you go to people like Peter Levine, for example, who teaches all about, somatic experiencing and trauma, I mean, even with the most severe PTSD, this is the work we need to do. Okay, that's important. Life is stressful. Stress is going to come up. Grief is going to come up. All these emotions are going to come up. Kids need to learn to manage it. Okay, they need to know that I can feel uncomfortable and still move forward with life. Thank you for joining me today. If you have any questions, obviously always reach out. I'm happy to help however I can. Help those kiddos be bold and courageous, and I will see you next time.